Hey, it's Chrissy. I'm here to talk about Ling San. So I'm here by some water to talk about a water pathology situation. So Ling San again is still a Tai Yang formula, but it's the third formula you might learn in terms of Tai Yang pathology, because you have Tang, you're sweating and you catch a cold. You have Tang, you're not sweating, you catch a cold and get achy joints and panting. And then there's another thing that can happen which is not so usual, but it still very much happens, and I still use this formula, at least once or twice a week in the clinic, is Ling San. So Ling San is called an organ strike as opposed to channel strike. So Tang, Tang is channel strike, whereas organ strike, because Tai Yang is small intestine and bladder, right? So it's affecting the hollow organ, the bladder, and it's closed. So again, we talked about the Chai Hu and open, close and pivot. We haven't talked about pivot yet because we're getting to Xiao Yang, so that's later. But if the organ closes down, which means the Tai Yang is too closed in the Chai Hu, then urination stops. So we're looking at a situation here where the patient caught a cold, and because of catching a cold or sweating too much, their bladder shut down, and it's kind of the beginnings of a UTI or enteritis or dizziness. So it can be three different things actually as a water pathology. So if we look at the formula, we've got in Ling San, which is 5 Korea, 5 Ling powder. It's usually given in the powder. Is Guaja at 3, and Fuling at 6, and Juling at 12, and Xerxia at 12, and Baiju at 6. So you can see there's 4 diuretics in that formula, so it's very much a water pathology driven formula. But there's 3 grams of Guaja. So why only 3 grams? Because there's 9 grams in Guaja Tang. A lot of the other formulas have 12, 15 or 9. This has only got 3. So what's happening is the patient sweated a lot, they lost yang, they lost fluids, there's dryness inside, but there's also a shutdown of the bladder because the yang left the bladder channel as they sweat. Because when you sweat, you also lose yang as well as fluids, the clear fluids. And then what happens is, in this situation, because they're already deficient, the bladder is shut down, they've stopped urinating, but there's still a floating pulse there, and the water mechanism is not working well. So what does that mean? What does that look like in the clinic? Okay, so because there's still a bit of an external pathology, and because Ling San still has Guaja, so it's technically still a Tai Yang formula, or it does treat Tai Yang as well, you're regulating the surface with the Guaja, but it's not fully just regulating the surface, because it's at the tail end of a cold. You're just warming the bladder channel just enough to relax the bladder, and then you're going to use the other 4 diuretics of Juling, Fuling, Baiju and Xerxia to actually make that fluid come out. Now if that fluid becomes too turbid, so if you don't, this patient does get doesn't start to urinate after this is pathology's passed, then the next pathology will be Yin Chen Ling San. So that's when the urination goes turbid and cloudy. So a cloudy and turbid urination is quite rare, but I have seen it quite a few times actually, more in male patients. I don't know why, maybe because they look at the urination as it's coming out more, and they're noticing it. That's quite a possibility in reality, but a lot of patients with chronic pelvic pain, CPPS, chronic prostatitis, men, they often complain of cloudy urination, which would be a Yin Chen Ling San, which is 2 parts of Yin Chen Hao powder and Ling San as a whole formula, and that will get rid of the cloudiness. So some damp heat is starting to form, but it's just dampness at that stage. If we're going into damp heat, then we're needing things like Bajan Tang, and or you could just do Ling San plus Chiachenza, something like that, and maybe that's probably gonna do it. But a lot of people use Bajan Tang. So that's damp heat, and then there's another formula that comes after that where the fever and the UTI has scorched the blood, which is the Tai Yang Hu Tang, and we'll talk about that next, which is another Tai Yang formula. So again, going back to what we're looking for in a Ling San pattern, because it actually took me a little while to work it out, and I remember when I was in Nanjing, Dr. Huang gave it to me one day, but he actually gave it to me, I had diarrhea and sweating. But my urination wasn't fully changed, so we've got to remember that typically you're looking for the bladder suddenly becoming abnormal and less. So inhibition of urination is the translation of the word you're looking for in Ling San. I think there's about 11 lines of Ling San. It is a really useful formula. What's happening is you'll see a bit of a floating pulse, but again, it's probably a floating and loose pulse because it's still, there's been a sweat and they've lost the yang that way. You will get 3 pathologies in the 3 jowls. So in the head you might get dizziness and nausea. In the abdomen you might get diarrhea, and then in the lower jowl you'll get shutdown of inhibition of urination, so less urination than what you would normally have following a cold and flu. Now it's not the most typical UTI formula, because people come in with UTI because they've got painful urination usually. They don't come in when they've just got decreased in urination, but some people do. And what can happen is that often follows not only Tai Yang but also Xiao Yang. So common formula that I actually use is called Ling Tang, which is Xiao Chai Hu Tang plus Ling San. And that's a great formula for people, especially older women, that I find that they always get a UTI after catching a cold, but it's the sore throat kind of Xiao Yang kind of catching a cold. And you plug those 2 formulas together and it's really beautiful. It's good also for like motion sickness and things like that. If you just got a bit of a nausea tummy, but you always get the sore throat, and you have a bit of flaring heat, and you've got a kind of hot and cold all the time, but then urination isn't as frequent as possible. No, don't use it for prostate conditions that much. There are other formulas that are probably better for not prostatitis, but for prostate hyperplasia and prostate cancer. There's much better formulas probably for that, and they're a little bit further on, and it's not following a cold that they get that too. So you will get thirst. The line says there'll be thirst. There may be dizziness. There may be vomiting water. Now, why do they vomit water, and why is there thirst? Because basically the bladder shut down. They're full of water, but it's pathological water. So there's still a thirst in the mouth because the fluids is not steaming up into the lungs and the throat. So their throat is dry and they get thirst. They may have a little bit of a fever because it's a hangover from Tai Yang, and their bladder shut down. But that key thing there is that, there's thirst, but also vomiting water. Now, I've never seen, very rarely do I see people vomiting water, but they might drink water and they go, I don't want it. My mouth's dry, I just want to swish it in my mouth, but I don't want to fully drink it. So that's kind of what you're looking with Ling San. And that's why it took me a little while to work it out, because it's a little bit tricky. But it's a safe formula. You wouldn't want to use it for too long, but it's a really useful formula. And again, going back to Nanjing and Hong Kong, when he gave it to me, I had diarrhea, it worked very well. It just helped contain that sweating a little bit. Urination was already normal, but it helped with the loose stools. So in children, he uses it. So in pediatrics, quite often Hong Kong uses Ling San for enteritis and the baby's vomiting water and clear fluids. All right, so hopefully that's quite helpful to go through the use of Ling San. A really useful formula and quite a safe formula, but there's a lot of cold herbs in there, so you wouldn't use it for too long. But super useful.